But among the top priorities of U.S. government at the time was health. That's why it took me by surprise. Why health should be among the top priorities. But on second thought, why not? Because healthy citizens are part of an economy which they wanted to grow because they wanted to dominate world trade. So health is very important. And as far as Mapua is concerned, just from the narrow viewpoint of Mapua, we became a university in 2017. And we're of course known for engineering and technology, but to become a university, we had to diversify into other areas of academic discipline. So we chose psychology. Now we'll be able to use it very well, but the initial impetus for psychology was to marry it with computer science in the field of artificial intelligence. We still have to, I guess, realize the dream. But we know also that psychology is an important foundation for the medical sciences. But it took quite a while before we worked up the courage to offer medical sciences in its full range. And it took the partnership with Arizona State University and Sintana Education Alliance, and also AC Health, for us to have the courage to offer these medical science, the health sciences programs. So we have 5 different independent fields of studies that has qualified us to become a university, and we hope to be able to have the big programs like health sciences as part of Mapúa University.
In Sintana Education in the United States, and I'm very pleased to join this meeting today where we're launching the School of Health Sciences at Mapúa University. And we're very excited to do this because we will have the opportunity to prepare the health professionals that the future of the Philippines and the world need through contemporary education, through best practices, and through that collaboration, which we've been working in for many, many months, and that we are hoping that you will find this a school that is unique, innovative, and definitely aligned to the best practices of the world in the education of the future health professionals. One of our aims is really about creating a professional that will be practice ready the moment they graduate. This is very much needed, not only in your country, but everywhere in the world, where the demands and the needs and everything that is happening in healthcare, whether it's in terms of disease, health trends, or technology, we need these health professionals that are ready to practice. And for that, the school that we're putting together, the school that we're opening at Mapúa University, will provide all that. Through the development of practice-ready professionals, this happens through the curriculum training, but also the development and the implementation of hands-on, immersive, highly technological laboratories and other learning spaces that will allow the students and their faculty to interact, to really prepare for the future of their practice. This is our high emphasis also in clinical simulation, bringing again best practices from all over the world, where the students will be prepared to take care of patients first through highly intensive, very immersive simulation laboratories, and then supplemented by extraordinary, really clinical arrangements, which will include our partnership with AC Health and other clinical partnerships that will allow the students to transition from those learning spaces and labs that will be the best in the country through clinical arrangements that will allow them to be really complete their education in the different degrees that we're going to have. And this is really a comprehensive health sciences offering for Mapúa University. And at the same time, we'll get them ready to practice the moment they graduate.
and has been recognized among the top 6% of universities in the world. Arizona State University brings in a unique opportunity to accelerate innovation and quality at scale. Together, we aspire to build a new era of top quality and relevant healthcare education. Recent milestones such as the Fourth Industrial Revolution, the passing of the Universal Healthcare Law, the COVID pandemic have transformed the landscape of healthcare locally and globally, highlighting the urgent need for skilled and practice-ready health professionals, both locally and globally. We join a growing network of top-caliber universities serving 140,000 students in 15 countries. This consortium is an exceptional opportunity to benchmark and share global and local best practices from several corners of the world. To prepare our graduates for a global digital future, we have designed virtual and in-person activities where students engage and collaborate with co-learners from different countries and cultures to better understand and address the health needs of our people and our planet. Recognizing the transformative power of digital technology, we integrate cutting-edge tools such as virtual and augmented reality, telemedicine, and electronic health records to enhance technological skills and prepare students for diverse practice settings. Our advanced and immersive facilities are designed to support active and experiential learning. Our partnerships with hospitals, clinics, and communities provide real-world exposure. From simulation to internships and service learning, students will develop the essential skills, gain empathy, and understand the social determinants of health. Through our undergraduate and graduate programs, we aim to develop highly competent, compassionate, and practice-ready health professionals equipped to meet the evolving needs of patients and populations in the 21st century.
Mapúa University School of Health Sciences partnered with some of the best medical and health sciences institutions in the country. For our BS Nursing program, which will be open this coming August, pending approval of the recognition from the CHED, from the Commission on Higher Education, we partnered with two public hospitals as our base hospitals, the East Avenue Medical Center and Mandaluyong City Medical Center. At this point, we would like to acknowledge the presence today of Ms. Evangeline Del Rosario, the Chief Nurse of Mandaluyong City Medical Center.
I am Mrs. Evangeline Mendoza.
I am sorry. Makati Medical Center, St. Clair Medical Center, and Hospital ng Makati. We would like to acknowledge the presence of Mr. Romel Alegre and Mr. Julius Binduan of the Nursing Department of Makati Medical Center.
I'm joined by our CEO, our Healthway Medical Network CEO, Jimmy Ismael, and our CHRO, Sean Zantua. And we're just so honored to be here, Dr. Bea and Fred. And I remember, I think it was in early 2021 when you first introduced Sintana to AC Health, and you said, wow, I think we're on the cusp of something special here. This was in the middle of the pandemic. And back then I said, Fred, clearly the pandemic has exposed significant gaps in the sector, especially in terms of capacity building and resources. Kulang talagang ng tao, kailangan ng tulong. And I think the country badly needed help from a staffing and training and skilling perspective. And so when Fred offered the opportunity to meet with Francisco, we said, absolutely. And it feels just like yesterday, but what a journey it's been over the last 2 years. Bonnie, I know a lot of different discussions, obstacles that we had to go through, but I'm just so proud and so excited to be here with all of you after all of those months and years of planning. I think that problem has only exacerbated. I sit as the Private Sector Advisory Council head for healthcare for President Marcos, and number one on our recommendations is to address the nursing crisis. I think when we first met, it wasn't quite a crisis yet, Fred, but now it is really a nursing crisis. And alam po natin yun na marami tayong mga nurse na ayaw na po magtrabaho sa ospital. No? Ayaw na. Pagod na. And hindi mo naman masisisi kasi mahirap talaga ang trabaho. It's a very difficult responsibility. And not just nurses, we have allied professionals that we sorely need. We need doctors, we need pharmacists, radtechs, medtechs, lahat na. But nurse po ang pinakamalaking problema natin. And we work closely with the Department of Health and with Chad, in fact, Fred sits on those meetings too. We need, I think, 90,000 nurses. 90,000 nurses po over the next 3 to 5 years. And that's because we have nurses who chose different careers. And again, you cannot fault them. But they chose different careers. They go to the hospitality industry, or they go to the BPO industry, or naghanap ng ibang buhay sa ibang bansa. Right? And again, we cannot fault them, right? And to us, as a country, though, it presents a unique opportunity to uplift our educational system and create more nurses, more quality nurses that can not only supply our needs both in the public healthcare system but also in the private sector, but also the needs of other countries.
Global classroom.
Because psychology, social education, biology,
Biochemistry.
Welcome. So this is our general ward for our nursing skills laboratory with patient now.
Oh, ibang patient na!
Different mannequins. So these mannequins, of course, for the nurses, but these mannequins we can have different procedures. And they can, of course, pwede namin palitan yung mga reproductive organ nila. You can have tracheostomy here for this mannequin. The other mannequins is a different procedure. Pwede siya. So, different procedure lang po. We can have right here. And the other one is for CPR. Yeah. That one, this mannequin is for CPR, so that students can practice. But it is actually naka-Bluetooth na to, so students can control also sa cellphone na nila. Medyo high-tech na yung mga CPR mannequins. Yeah, VR.
Delivery.
So normally, sir, we only cater 1-2 students here and the CI because the rest of the students are in the viewing room. That's why may mga naka-built-in kaming camera. So, of course, this is the very popular Noel. Noel, the birthing room, the birthing mom with a baby inside.
Sige nga. Sample.
Diba? Ay, hindi nakasaksak, sir. But may baby po siya sa loob.
Surprise!
Surprise. Pero normal delivery po to, sir. Hindi po siya cesarean.
O, ganyan pala yung cesarean. O,
Pag cesarean,
tinataas lang pala.
Tinataas na lang. So, there's a baby inside with the uterus naman. And the baby. So, it's a normal delivery where the baby will be pushed in. Yeah. So, nandito naman ang baby with a control sa TV naman. Sa ano namin, sa monitor ng iPad. So, pwede naman mag-coil, umbilical cord, and so on and so forth. Normal and abnormal, pwede dito.
Kung suhi.
Pwede dito kay Suhe. Normal and abnormal, pwede dito kay Noel. Oh, Noel, meet your guest. Meet your friend.
Congratulations, it's a boy.
Yeah, it's a boy. Some students are having their performance, demonstration, return demonstration there. Some students will be staying here so that they can still view what other students are doing in those laboratory spaces.